So hello, everybody. I'm going to do some just brief introductions. So I'm Felicia. I'm the owner and registered dietitian behind Pertains Nutrition and My Dietitian Journey. I'm a dietitian, health and wellness coach, board certified, ACSM certified personal trainer, and I have a master's in dietetics administration. Outside of my business, I'm also a faculty instructor at a local community college. I teach nutrition and then also health coaching. And I have two separate businesses, the Pertains Nutrition, which is client-focused, working with patients primarily virtually, and My Dietitian Journey, which is geared towards dietetic students and fellow dietitians looking to start their own practice.
Hello, my name's Adam. I'm Felicia's biller, schedule, and digital media manager for her two businesses, the My Dietitian Journey and Pertains Nutrition. I have a bachelor's in business administration and a certificate in medical billing and coding. Outside of this, I'm a food service manager at hospitals.
So just to give you a little bit of an overview of what we'll talk about today. So just to outline a little bit of my journey, my background, I'll talk about my practice and some common questions about starting. And then Adam's going to cover the billing and coding parts with accepting insurance and then also filing claims. And then we'll have the Q&A portion. All right. So just I want to say before I go into this that everyone's timeline is going to be different. And so this isn't necessarily supposed to be like a gold standard of how your journey should look by any means. I finished my undergrad. I went to Westchester University. I finished in 2013, and then I did my internship right after. So kind of more the traditional route of, undergrad, internship, passed the RD exam, and then went for my master's after that. We're in Pennsylvania, in Bucks County area, if anyone's familiar. But I was able to do a distance program through Utah State University. So I was able to complete all of my rotations in Pennsylvania for my internship. I took my RD exam about 6 weeks after I finished the internship. And at the time, I was already working as a preschool movement instructor. So basically gymnastics for little children at a YMCA, which is a community center, nonprofit. And then once I became a dietitian, I was able to start doing one-on-one nutrition counseling services. I also got hired as a part-time retail dietitian at a supermarket, which was a really fun job. And then that same year, I started my practice, but I really just created a website and said I was taking on patients. I really didn't do too much just yet. And then in 2015, I really started to kind of focus in on the business. So I started with a sole proprietor EIN, which later ended up going the LLC route for both businesses, which is something that I highly suggest. And then that same year, I started my master's program and then went full-time with the retail dietitian position. I was in a car accident at the end of 2015, which led me to quitting my job at the YMCA and then kind of putting my business on hold. So mid-2016, I kind of really started to see more clients, started going to networking events, working as a dietitian, more in the retail setting, but then again in the practice. And then I finished my master's. So from about 2017 until now, things have changed a lot. I used to do a lot of in-home sessions. So I would actually go to the patient's home and conduct nutrition counseling there. And then I was doing a lot of on-site for businesses, which it was a lot of traveling, but I would try to put everything close together so I wasn't making too many trips back and forth. Obviously, with COVID, that made a difference in terms of the telehealth portion. So I was doing a little bit of telehealth before that, and then just obviously went full 100% telehealth. And I've stayed that way. We might transition to going back to some face-to-face, but still kind of in a 100% telehealth at this point and kind of see how things go. So along the way, I've done a lot of different partnerships. I've done cooking classes, webinars, seminars. I worked with school-age children, and then also started the My Dietitian Journey, partially because I was like, there's not enough information out here for dietitians who are starting a practice and just kind of sharing resources and how to get started and, what it's like to be in private practice. So that's kind of where that part of the business came from. I also teach, now I'm on a full-time tenure track at a community college, but I started teaching adjunct. And so that's something that can really fit nicely in with the business because it's, not a 9-to-5 kind of job. And then I can see clients around that. So in terms of private practice for me, I really just wanted more flexibility with my day, the patients that I saw, what I would do with classes. I wanted to be able to work from anywhere. And obviously with kind of the telehealth changes and with COVID, that kind of accelerated a lot more of that aspect. I really wanted to have more creativity in what I was doing, which is really what led me to private practice. One thing I will say is if any of you are really interested, which sounds like from the nature of the internship program, most interns that I've worked with from this program are looking to start a practice in some way or another. But making sure that you are organized, you don't have to be super organized, but everything really falls on you when you're in private practice. So being self-motivated. And for me, I didn't have any kind of business or entrepreneurship built into my internship. It was something in my master's degree that I chose as an elective, but it was really just kind of doing a lot of Googling and just figuring stuff out and what actually worked. But if any of you are interested in private practice, I'd really love to know why, what makes you interested in private practice. So feel free to jump in and share any of that in the comment section. And in terms of private practice, most people think private practice, one-on-one nutrition counseling, that's about it, which is kind of what I thought when I started private practice, is that I'm just going to see people one-on-one and that's running a practice. But it can actually, being an entrepreneur can really be a lot of different things. So if we're looking just in the lens of dietetics, there's obviously one-on-one counseling, there's group coaching, there's recipe development, media appearances. So dietitians write books, some do lots of speaking engagements, others write for magazines or websites. So there's a lot of options for how that entrepreneurship can really look. And even in private practice, working one-on-one, this can really vary. I work a lot with plant-based focused with the pros nutrition aspect of things. I will say that the majority of my clients are not plant-based, but that's kind of the lens that I like to work through, is trying to emphasize more of the plant aspect. And I see connection with individuals, stronger community bonds, and education in terms of a reason why. So I love that. Definitely feel like when you're able to create your own resources and kind of build a practice in the way that you want, that you can kind of work with the clients that you might be most drawn to and kind of niche down, which I will say is not a requirement, because when I started the practice, I just worked with anybody. You don't need to have a particular niche. I do in terms of what's on the outward facing. So in terms of like plant-based focus and sharing recipes that are plant-based. But again, most of my clients are not necessarily in that space. Trying to add a vegetable to their plate is, a win. So, and some of you might be sitting here and thinking, I don't know what I want to do. Not really sure. Maybe it's private practice, maybe it's not. And that is totally fine. Fine. Finding your way isn't really an end goal. And you might plan for one career. Like I didn't think I was going to end up teaching at all. So volunteering, working, shadowing, that can really help with the initial interest. And then also the aspect of the internship itself can be really helpful. Yes, the flexibility. So I'm just reading these comments because I love the flexibility aspect of having a practice, being able to schedule on your own terms, being able to say, like, I'm not going to see clients on Fridays. I'm not going to, do this after 5 or 6 p.m. Or I like to start my day early so I can see a client at 7:15. And so that is something that I really enjoy about having a practice, is just being able to set whatever schedule that I would like to. One thing when you think about what a practice might look like, if it sounds like a lot of you are interested in that aspect, when you're building a practice, it might start some way and end up being something totally different down the line. And that could be whether the services that you offer, the clients that you work with, anything like that. So it doesn't mean that the way you start means that you're locked into it. You can always change and modify and tweak. I used to run a lot of cooking classes face-to-face, and they got to be a little overwhelming. And so I kind of scaled down on doing those and really focusing on the one-on-one aspect of nutrition counseling. One thing I would highly suggest is networking. So this is not only important for if you're looking just to obviously get a job, but building connections, engaging with other dietitians, other students, other interns. And really also gives you an opportunity to explore what other options are out there for either building a practice or being hired within a practice, or maybe doing something else. Like maybe you don't want to start with a practice and you want to start, being hired by a certain company. And you never know what kinds of jobs are out there. Like in my internship, my one of my preceptors at the time had joined the Navy and left 2 weeks into my food service rotation, which was stressful, and joined the Navy as a dietitian. And I was like, I didn't know that was a thing that you could do. And so that was really exciting just to be able to see the different opportunities as to what could be possible with being a dietitian. So, you learn and you get to figure out what you like, what you didn't like, research and just kind of talking with others. So how to get started in private practice. So there's a few key steps that you want to think about when you're establishing yourself and your business. The first is just getting yourself organized. There's a lot of steps and they're pretty simple steps, but it's a lot of kind of keeping track of paperwork and when you submitted this and that. So just kind of prioritizing a list, getting it together, seeing what needs to happen first. One of the first things, if you're in the United States, would be the EIN or employer identification number, which is the federal tax ID number. In order to fill this out online, you need to know your business structure. So are you going to be a sole proprietor, LLC, partnership, state-specific paperwork? So I'm in Pennsylvania, and depending on your state, you might need to file what's called articles of organization, which usually involves a fee. So that's something that I had to do for Pennsylvania. Getting your NPI. So the NPI is a national provider identifier. It's a unique 10-digit ID for covered healthcare providers. So there's a type 1 NPI or an individual NPI, and this follows you around. It's like your social security number, basically. So it's following you around. So whether you are working for yourself or you work for another business, this will be your individual NPI. And then there's what's called a type 2 or organizational NPI. So I have one for Pros Nutrition. I have an organizational NPI, and then I have my individual. And this is something that you would need for billing insurance. I would highly suggest, if you don't already, to get your professional liability insurance, which will help to protect against negligence. I use the one recommended by the Academy, which is just the Pro Liability by Mercer. And then I also have an add-on to it for non-patient care services, which then covers like educational and consulting piece of it. It's like $25 more per year. So it's pretty insignificant. And when I think about, business costs, to just add that on to cover anything educational based. And some professionals that you might want to reach out to when you're building your practice could be a tax accountant, an attorney. With both of those, look at your free library if you have any local to you, because a lot of them offer business resources. Like I met with a librarian for free, and they went through a lot of information about business, and they were able to connect me with some different free business services in the area. And then just some general kinds of tips when you're thinking about building your practice. While you're starting all these steps, and we're going to talk about becoming an in-network insurance provider, you can work on building a website, a blog, engaging on social media, starting to market yourself. So while you're kind of in like a lag time of like maybe waiting on certain pieces of things to go through, there's other things that you could start working on. One thing that we'll touch on in terms of support is that you don't need to go this alone, but be cautious of people telling you that there's some secret method to building a practice. And that's kind of where my dietitian journey came from, is that these are the steps basically in starting a practice. There's, maybe some little minor things along the way, but, joining Facebook groups, finding a mentor, hiring an accountant, reaching out to, fellow dietitians in private practice, can be really helpful in just kind of finding support. And the Nutrition Entrepreneurs Practice Group of the Academy is also a really great resource, and they offer free mentoring. So that could be a really great option. The Academy also offers mentoring now too. So that's another free as in part of the membership that you pay. So taking advantage of things like that, because I know there's a lot of like coaches out there and whatnot, and they could certainly be helpful, but they're not necessary. There's lots of really great resources to get started with. And you don't need to start with all the bells and whistles. I started with paper charting on an encrypted flash drive and locked filing cabinets. So you don't need all the fancy things to start, but things that I would initially suggest would be an EMR platform. So your compliance software that can be where you do all your charting, where you can bill insurance, where you can have secure video sessions, looking at scheduling. So it just kind of integrates everything together. It could really streamline things. I use Simple Practice, but there's other ones out there like Practice Better, Healthy, and Calyx. And with an EMR, it saves a lot of time. So it is a cost, but I spend so much time manually sending email reminders and paperwork out via email with PDFs that it was just very much inefficient. But I was trying to save money initially. So you could certainly start off that way, but I think an EMR to start really can help streamline things. All right, so I'm going to talk about becoming an in-network provider, and then Adam will talk about the billing and coding side of things. Once you have set up your EIN, your NPI, your liability insurance, and then again, any state-specific paperwork and state licensure, the next thing would be to fill out the CAQH ProView online application, which is a credentialing database. It really just eliminates excess paperwork with insurance companies. And then you would apply to each insurance company that you want to work with. So most insurances have a link on their website that says, join our network or become a provider. And what I did to start was just kind of searched for, different insurances in Pennsylvania to kind of figure out what would be those main insurances to start reaching out to become a network. The next step in the process after you fill out that initial form is credentialing, where your information, like your education and your training, would be verified by the insurance company. And then this would be followed by contracting, which is the process of being an in-network provider. The entire process can take anywhere from 30 days to 60 days to even longer. And so I would highly recommend keeping track of when you submit applications. So that way you can go back to that note section and say, okay, I submitted this 90 days ago. I need to call the network and see where I am in the process. Keeping a log of when you submitted the applications and also where, and then noting down the numbers that you called, it just will help because with accepting insurance, everyone has a different process and time frame and different numbers to call. And so it just helps to keep it organized to say, okay, Blue Cross Blue Shield, this is the network provider line, and this is who I need to reach out to, and this is how long it's going to take, and this is when I submit my application.
So a brief overview of medical coding. There are ICD-10 codes. ICD-10 is the 10th edition of the International Classification of Disease Codes. Those are the codes that you'll be working with as dietitians in private practice. There are PCS codes too. They're for inpatient. PCS is the procedure coding system, but it's all inpatient in hospitals and stuff. CM is the clinical modification of those codes. CPT codes are the procedure codes, so what's actually being done with the patient. So ICD-10 is the disease, CPT is the procedure. Place of service codes indicate where the service was done. And if there's anything you take away from my piece of this on medical billing and coding, when you're coding what you do as a dietitian, the most important thing for any provider is to be as laser focused and specific as possible with the codes, because there's a bajillion codes for a bunch of weird stuff, and insurance companies care which codes you use specifically. So for instance, place of service codes, 11 is an office visit, typical office visit. 10 would be telehealth. And this is a new thing. This is recent. 10 is telehealth if the patient is in their home. 2 is telehealth if the patient is in a different home. We ran into some trouble with these place of service codes pretty recently. But just to give you an idea of how specific these get, 60 is the place of service code for a mass immunization center. So like we've been seeing, we at one point saw COVID vaccines being given out in pop-up tent facilities and stuff like that, that they're coding with place of service 60, 42. So if you've ever seen a medevac helicopter taking off and transporting a patient, they're using code 42 for their place of service. It's a ambulance, air or sea. Modifiers will modify a CPT code. So we use modifier 95 a lot. Modifier 95 indicates that a CPT code is telehealth, synchronous audio and video. And these get very specific too. 50 is a bilateral procedure. So if a procedure was done, on both ears, let's say, 63 is a procedure performed on infants less than 4 kilograms. So a lot of these codes need specific modifiers to really drill down what exactly they're for. And units is another field where you'll input something. And when you're filling out your forms for billing, units are used to basically indicate a lot of codes. They go by, they're timed, or they go by size. So if someone's administering a drug, how many cc's, that would be like 5 cc's is 1 unit. So if there was 15 cc's, they would bill for 3 units. It could be weight, but for your codes, they'll be time. So how does this apply to you? Well, there is only a handful of codes that you really need to care about when you're billing for your medical nutrition therapy appointments. So you've got a code that's just sort of general. This is the weird thing about this too. ICD-10 is supposed to be disease codes, but there's a disease code for dietary counseling and surveillance. So it's one of the codes you'll use. And as dietitians, it's important to know that you're not intended to be able to diagnose. A lot of these codes would come from, so if someone's got hypertension or kidney disease and you get codes for that, that would come from a primary care provider or a referring specialist. It's important that a dietitian wouldn't diagnose hypertension. That can get you into some trouble. But you are freely able to use these codes here, BMI codes and this Z71.3. Have you used, what was that comment? Have you
Sorry,
used?
so I just wanted to ask about that group code. And is that actually being able to be used now?
Oh yeah, that's the one for groups. Yeah, you can use that one. Have you used that? Have we used that, Felicia?
I haven't used it recently, but I have before. And one thing with the 97804 code is the unit time is different. So it's 30 minutes and it's a group as anyone, two or more. So like a couple, you would use that code. And that was something that came up a lot with dietitians asking about that question, because if you worked with a couple, like I would do home sessions, so a lot of times I would work with a couple and you'd bill using the 97804 for each of them as the group code versus 97803 and 97803 if they were sitting together and sharing the session. Now, if you had one and then the other, then you can use the 97802 or 97803, which are on here. But the other thing with the group code is, and just as an FYI, I can't discuss what you receive in terms of reimbursement from insurance, but the billing rate will be less than an individual session. So that's just something to keep in mind. It's not significantly less, but it is a change from an individual CPT code.
I guess the aspect of it being timed differently, it's 30 minutes per unit. So if you do group sessions, in terms of the time, you end up billing for less units, which is effectively how much you get. So that was a good segue. Yeah, there's 3 CPT codes. Well, real quick, the BMI codes. Those you can use freely. You're technically not diagnosing, it's just a calculation. So you're able to put down a BMI code when you're billing insurance, and that doesn't need to come from a primary care provider or a referring physician or specialist. So the CPT codes, we mentioned 97804, that's the group code. There is an individual initial and an individual follow-up, 97802, 97803 respectively. Those are the only codes. There's so many of these codes. That's kind of the nice thing about dietetics. If you're a private practice dietitian, these are the only codes that you'll ever need to worry about actually using and assigning yourself.
You might be wondering, like, how do you figure out what to use and what the insurance will accept? And this is where the medical policy comes in for each insurance company. So what I suggest for people to do, and something that I do, is I review the medical policy for nutrition counseling for the insurance company. And this is specific to each insurance company. And that has information about the CPT codes, the different ICD-10s that are accepted, and then the place of service specifications. So whether or not they accept telehealth or home visits or things like that. And this can give you just like a basic understanding of what insurances cover. And then you can call and verify the client's specific benefits. And then when you call the insurance company, you can get information about that specific policy. Some people say, well, you should have the patient call and verify benefits. I don't necessarily think that's helpful. I think that being able to call insurance and understand the process of what that looks like is really helpful. But if you do have the patient call, making sure you give them a script so they ask the right questions.
Yeah, we ran into something changed recently where Z71.3 is no longer acceptable to be the only diagnosis code you're billing for. I think with independence now, right?
Aetna was the
Aetna.
one.
Yeah. So these things change. It's important to keep up with policies for that sort of thing. You'll get claims denied sometimes because something changed in the policy and was working a few months ago and now it's not.
We figured that out the hard way. And I know a question came in. I think it makes sense to cover that. How do you minimize the amount of time spent on the phone with insurance companies? Either way, you can end up being on the phone for a while. So a lot of times actually Adam does a lot of the calling now, but in the beginning when I was kind of like, I don't know what I'm doing, I would make a lot of phone calls and be on hold a while. So I would just multitask, have the phone going, be on hold, and be doing other things related to the business. The one thing to keep in mind when you're calling is that you want to have specific information available. So you need the member ID, the member's name, their date of birth, your business information, the specific CPT code, place of service code. So make sure you have that information available, because the last thing you want is to get a representative and not have that together, and then you need to call back. So that can help you to save time. And I would really avoid calling close to when they're closing. I did that. I called at like 3:45 the one time, and I got transferred. And then eventually I was hung up because it was, and then I tried to call back and they're like, oh, we are closed. So just keeping mindful of the time frames when you're calling too. But that's something that can help with the amount of times you call, having that information available.
I don't really think there's a way to avoid the hold times. You're just going to be on hold for a while. I think last time I called for you for Felicia for rectifying some claims, I think I was on the phone for like 50 minutes. It was a few claims, but that's just kind of how it goes.
Yeah, I asked that question because the last time I was calling, it was probably an hour. I was on hold.
Sounds about right. Yeah.
Okay. I didn't know if since that experience, if you guys had figured out something or a method to minimize that time when trying to confirm benefits.
The best method is to hopefully do all this stuff right the first time and not have to call them, because they're kind of ridiculous to deal with directly outside of their direct input system or outside of a clearinghouse. The insurance companies are just kind of a pain like that, unfortunately.
The only other thing I would suggest, well, one, not every insurance company you'll be on hold for an hour. Medicare, really great. They answer and they're super nice. They've walked me through lots of things when I changed from a sole proprietor to an LLC and reassigning benefits. And I just wasn't expecting that when I called. So was like a breath of fresh air. But one thing to keep in mind when you are calling is that if you can get the network coordinator information. So for a while, I had a specific network coordinator for independents. And then that person was gone. So trying to get the new network coordinator. And sometimes I can give you a direct link to someone. So their phone number, their extension, whatever it might be, which can help to get you to the right place a little bit quicker. That isn't as helpful for verifying benefits because you still have to go through the process. But if you have issues with something, that person can maybe help escalate things. And then if you email anyone or anyone ever emails you from an insurance company, save those emails and specifically the email address. I've done that with like Cigna, United Healthcare. And then when I submit some stuff and I don't get any information back, or call and I don't get the right answer or a helpful answer anyway, I'm like emailing the 5 emails I have, and eventually someone either answers or will send me to someone else. The end story here is that you have to be persistent and maybe a little bit annoying to these people, but otherwise.
No, you don't have to sugarcoat it. You have to harass these people. Seriously, that's the way it is. And so I externed during my medical billing and coding program with a pain management practice, and I hung out with their employees at the billing office. And this was kind of what they told me, is that you have to harass them. You have to like bully them practically, because they don't. Insurance companies, they're like any other insurance company. They don't want to pay. So you kind of have to wring the money out of them sometimes, and you have to call them repeatedly sometimes. And one thing you can do, so to actually answer your question, Natasha, like a real answer would be, if you call an insurance company and you actually get someone who is helpful, get their direct contact information. Go directly. Felicia kind of mentioned that, but if you get someone who's actually helpful, because a lot of times you'll call and if you need some information, they'll just give you a runaround. They won't be direct. And sometimes they will be. And those people, you get their number and you try to reach out to them directly to save some time. Filing claims. So that's kind of where we're at anyway. So you can file claims directly through a provider portal. So a lot of every insurance company has their own sort of provider portal that you can go to. It's a website directly that will send the claim right to them. It's direct. There's no fee. And the only issues really are that it's different depending on the insurance provider. So if you're a provider for 10, 12 insurance companies, you'll have to go to a different site to file claims depending on the patient's plan. And you have to enter the information manually per patient because of, you have to find them as a member. And then they walk you through the process. It's pretty intuitive to use, but you end up having to key in more information manually if you go through a provider's portal directly. Whereas you could go through an EMR, which Felicia has Simple Practice, and that's got integrated billing. In your EMR, your patients are already in there as your patients. You have a calendar system, scheduling system, stuff like that. So a lot of times you can just hit create new CMS 1500 and it'll auto-populate a bunch of their information. That's helpful. And then that claim, when you send it off, it goes to a clearinghouse, which is kind of like a middleman between you and the insurance company. They just make sure that there are no errors. If you send a claim directly through a provider portal and there's an error, it'll just get rejected. You won't know why. And if you're not sure why and you try to rectify it, it doesn't get approved, that's when you end up having to call and waiting for a long time. So the nice thing about a clearinghouse is that they'll take care of that for you and it'll bounce back to you before it hits the insurance company directly. And there is a small fee associated with that generally, depending on what you're paying for. If you have an EMR, it could be included with what you're paying. Otherwise, it's a really small, it's like 24 cents a claim or something. So it's really not that big of a deal.
Yeah, and the EMR that I use, I have like the as much as you could pay per month plan. And so I get like so many claims, included in my plan. And then it's, like 20 something cents after. And so that's something that to look at too, if you are looking at different EMRs to just see, if they embed filing the claims within that platform or if you use an external platform, and then is there a cost per claim?
Filing a claim it's a pretty straightforward process. And one thing I'd like to iterate is that to me, it's kind of a shame that this is a point of contention in dietetic private practice in general, that billing is a struggle because it is very simple. I find that I keep seeing a lot of dietitians running a private practice when they're new and they don't have a lot of clients, they just struggle with this process and they end up paying someone to do it. I don't think you need to do that. I think this is easy enough to do on your own for sure. And just to really hammer that point home, this is what it's like to file a claim. So, and I did a couple last night. This is exactly what I did. Typical claim. We have a lot of clients that have independence. So for a client where Felicia had a 60-minute appointment, a follow-up appointment, a reassessment, if the patient has independence, I would go to Pair Portal. The website is pairprovider.com. You can go there and look at it. There's a little login. You can't see much from the landing page, but I would go there, log in, and I search for the member with like a long, it's an alphanumeric code. Then they show up. I can click them and then click create new CMS 1500. And CMS 1500 is it's Medicare's form. And one thing with insurance in general, just health insurance, is that Medicare in the United States, Medicare is like the gold standard. What they pay is kind of what insurance companies loosely base what they pay off.
One thing with Medicare is that their reimbursement rates are public information. So you can actually go to Medicare's website. So if you're curious, like what Medicare reimburses, you can actually search for that on the Medicare website. So that information is public. The other information in terms of like what an insurance would reimburse, you'd get that through your contracting phase when you're in network. And then again, that's the stuff that you're not technically not allowed to share. It violates your contract.
What I should say is if you get credentialed with Medicare first, everyone else is a lot easier. So that would be a good goal, a good first insurance company, quote unquote, to get credentialed with first, to become a provider for first is Medicare. If you get through that, the rest are easy. But in this example, so let's say independence, most of our clients, I'm logged in, I click create a new CMS 1500 form. I key in the place of service and the patient's account number, which is arbitrary, sort of, we just make it up. And then there's a couple screens where you just kind of click through because there's a lot of stuff that dietitians just don't need to worry about. And then we get to a screen where I key in diagnosis codes. So that these two codes here, that's the dietary counseling code, and the Z68 are the BMI codes. So I put in those codes, and then I key in the CPT code for this one. It's a follow-up, so 97803. I click through a couple more screens. I get to another screen where I can put in the date of service, the place of service. There are diagnosis code pointers. You have to just like kind of check off that those are the ones you're intending for that specific CPT code. When you file claims, you could be filing for multiple CPT codes, and all the diagnosis codes don't apply to each of them. But in our case, they do. You would indicate the number of units for a 60-minute follow-up. It would be 4 units because they're 15-minute increments. The 97802 and 3, they're timed codes for 15-minute increments, and the group code is for 30. We always add modifier 95. So one thing to bear in mind is that your medical nutrition therapy CPT codes, they do specify face-to-face. So 97802, 2, 3, and 4 in the lexicon, in the CPT code manual, it specifies that code is for face-to-face interaction. So you need a modifier to indicate that it's synchronous telehealth. And then I add the modifier, click through another screen, review and submit. And that's all there is to filing the claim. Maybe that sounds like a lot. You do this a couple times, boom, boom, boom. It ends up being really easy. And I always file Felicia's claims within a week of service. It's important to file claims in a timely manner. There's a lot of reasons for that, but just an extreme example. Let's say you have a couple appointments with a patient and they pass away. You're not going to be able to bill for those now. That's just one of the intricacies of how this stuff works. And there are other reasons, but it's long story short, it's important to file in a timely manner. But that's all there is to it. It's really easy. And I don't think dietitians should pay anyone else to do it. There's just too few codes and too few steps involved. If you got 100 clients, sure. If you don't want to deal with it, that's fine too. But that's all there is to it.
So some helpful resources. These were some of my go-to resources that I used when I started, plus kind of periodically throughout. So the IRS, the SBA, which is the Small Business Administration, SCORE resources. They have so much free stuff online specific to business. So a lot of this stuff isn't necessarily specific to dietitians, but specific to business and starting a business. So that could be really helpful. Dietitian related, so obviously HIPAA, the A&D website, and then I definitely recommend the Nutrition Entrepreneurs group. And then in terms of like social media options, like Facebook groups, I'm on a couple of different like insurance and credentialing groups on Facebook. And then we have a podcast, My Dietitian Journey. So Adam and I, and so we have podcast episodes, video podcasts on YouTube, but also we have short form videos too. And we have podcasts on telehealth and insurance and starting a private practice. And so we've been doing those over the last couple of years, and it's something that we'll continue doing with just sharing information and resources. And then here is our contact information. So the main business line, social media handles, and then my email, and then also Adam's email. So if you have any questions for either of us, feel free to reach out to us. And thank you all for having and hosting us, Farrell, for today. And so we'll take any questions.
Thank you both so much. This was wonderful. I definitely learned some stuff. I wanted to can I ask a quick question?
Yeah.
Okay. For the 97802, is that a one-time, or can you use it? Like, let's say you have a client and you see them every year. Can you start it again at the new year?
So it's typically a one-time, and Adam and I've actually had this conversation a lot as to at what point can you reuse this code, or is it always going to be? Because I had someone who was with a commercial insurance and then now has Medicare. Like, well, it's a new insurance, but they're not a new patient. So you always want to bill for what the actual service was that was rendered. So unless it's been, 5 years and you are doing kind of like an initial appointment with someone, then you'd bill for what that service was that was actually provided. So regardless, every year I'm using 97803 for my recurring patients that I work with, because that's the service that was actually rendered.
Thank you.
I guess one more note on that is if you were to use it again, technically it would be not the correct code, but generally speaking, the IRS isn't going to come busting down your door because you used an initial instead of a reassessment code. It's just best practice, generally to try to stay as accurate as possible with codes.
Yeah, the ethical billing side of things, and then also the aspect of, insurance, if you were audited, could come back and claw back those payments and say, wait a second, this wasn't the actual documentation and service that was rendered.
So what happens if you accidentally use the wrong code while billing? Depends on what it is. Sometimes it'll just get paid. And then you've got an issue on your hands where there's like an ethical boundary that's been crossed, whether it's intentional or not. If you're audited, it's not really something they care about. If you meant to break the law or not, you just end up being guilty either way. If it gets rejected, then you'd have to figure out why and see which code. It's kind of hard to use the wrong code. Well, if it's an accident, that's one thing, like a typo or something. What do you have on that, Felicia?
So if you use the wrong code, one thing that I would suggest is sometimes you can't actually correct the claim until it's been processed. So the issue comes in if you do get paid, you might have to return that money if it's something that would be something that, oh, I shouldn't have gotten paid for this or something like that. But you can submit like a corrected claim. I've done this before where I entered in something incorrectly or the units were off or something like that. And I had to wait until the claim was paid and then do a claim correction on it, which is pretty simple to do. It's just like a little bit of a drop down or like a 7, depending on what platform you might be in. So it's not super crazy to do, but sometimes you have to wait until it's processed, because I've called before and they say like, oh, we can't do anything until the claim's actually processed. But I just wouldn't do anything if you do get paid for something. Just don't do anything with that money just yet, because it might be that they'll retract the payment and issue a new payment, but you want to make sure that it all aligns. Oh, this is a great question. How long does it typically take to get paid by insurance? If you file correctly, and if you're doing a electronic funds transfer, you get paid a lot quicker. So I get paid anywhere from, depending on when they batch the claim, anywhere from 3 to 4 weeks out. If it's past 4 weeks, something's wrong. And so it's either denied or, it's usually denied. How do I keep track of how much is owed? So we have a spreadsheet that we use. So I'll put in what claims are pending, and then Adam files the claim itself. And then that way we could see the date when it was filed, to what platform. And then that allows us to kind of keep track of it. And then I have a separate financial spreadsheet with tracking all the payments. And I track from which insurance company too, so I can see kind of which insurances I'm working with primarily and kind of what that income looks like.
Anne's got a question about codes for insurance companies. They're all the same. The only thing that changes is which codes insurance companies accept. But like Z71.3 is dietary counseling and surveillance for every insurance company.
The only thing, and when you're looking at a medical policy, that's where you're going to find which specific ICD-10 codes are accepted by that insurance company specific to nutrition counseling. So that's where you would look at the medical policy and pull that and say, okay, down here. And I just pulled one recently for independence, and it was like, I don't know, 70 different codes. And so using like the same 5 codes over and over again, but, specifically looking for a hypertension one that a provider had sent a referral for. So I wanted to make sure that it was an accepted code. If not, I would need to contact the physician for a new referral.
What happens if you make a medical diagnosis by mistake? So that's an interesting question. It would be kind of tough to do that. So you'd have to, when you enter in your diagnosis codes, you're going to manually key them in. And in every platform I've used so far, you key it in and then it pops up what the code actually means, what it stands for. So you'd see if you input it improperly, let's say, and it's like, whoops, this is a kidney disease code, didn't mean to do that. It'll show you and say, if you do that by mistake and a claim gets paid, you end up in a situation where there's like an ethical boundary. That's what happens. So the way insurance fraud works with this stuff is like, you don't get caught the moment it happens, or something that doesn't pop up the moment it happens. Things can go through. There are massive insurance scams where people make like hundreds of thousands, millions of dollars, and like 2-3 years later, the IRS catches up with them and they end up in jail. So something like this, it's best to keep an eye on everything while you're doing this and to try to make sure you don't make those mistakes. If you do, it's not the end of the world. Like Felicia said, you can rectify the claim and make things right after the fact when you notice it.
And you can use a medical code. Like I was talking about hypertension code. You can use a medical code. You just can't diagnose. So you just need to have either referral, or depending on the insurance, you can use just documentation from the physician. So like I've had them send me over medical records that list all of the diagnosis codes that the patient has. I'm not going to use all of them because they're not relevant to what I might be doing in nutrition counseling, because there's one for the knee and this and that. But it would be on there. I'm not making that determination what the patient has. I'm just looking at the medical record and saying, hypertension, yes, during medical nutrition therapy, we covered medical nutrition therapy specific to hypertension. So that is the appropriate code. And it's also the accepted code by the insurance company. But I'm just getting that information from a specific referral or documentation. So you can use a medical code. It's just a matter of you can't make the diagnosis yourself.
Question from Husna saying, Carly asked another question. Will insurance companies stop covering virtual or telehealth appointments soon? It doesn't seem like it for medical nutrition therapy or other like psychiatric codes and things that make sense via telehealth, speech therapy, stuff like that. But for other services, that is trending as COVID sort of gets normalized and controlled. For instance, I was at a pain management practice and they were doing telehealth appointments for reassessing medication needs, and they are weeding that out. But it doesn't seem that that'll be the case for stuff like medical nutrition therapy anytime soon.
So the one thing I wanted to just say about the virtual and the telehealth appointments is that one thing that insurances can do, unfortunately, is lower reimbursement rates for telehealth, unless your state specifically has parity laws, which I recently learned about, where they aren't able to change the reimbursement rate based on where the service is held. So that's something to look into, but that can be, where it isn't necessarily that they're not covering telehealth, but they're just reimbursing you less.
One of the rates went to 85% recently, I think.
Yeah. And the Academy did a lot of work with reimbursement rates with Aetna recently. So there was a letter that they posted about there was a change in rates reimbursement from Aetna to providers for dietitians, not necessarily for telehealth, just across the board. And that has been since been rescinded, I guess is the right word. So that was a positive. For group codes, you need parties to be seeing both. To both parties you're seeing, both have to be your clients. You would need to have the information to be able to bill for it. So yes, because you would need to have that on file in terms of like their member ID, consents on file that you are, like I have a practice policies form that says in there that, they are consenting to allow me to bill their insurance on their behalf and that payments will come to me and things like that. So I'd say best practice, yes, because you're going to need to enter in that information.
What happens when you receive a referral from a primary care provider for the patient to see you for a specific code, and then the insurance company doesn't cover it?
So first thing would be whenever I receive a referral, most physicians, if you're calling for a referral, they'll ask you what you need it for. And so I'll say nutrition counseling, or I need a specific code for hypertension or a diagnosis that covers for diabetes or whatnot. So I'll ask them. They're not going to just write a code on there if their patient doesn't have hypertension. So a lot of times it's a patient will say, oh, I have hypertension. My physician can write a code. When I make that phone call, they're going to write down obviously the correct diagnosis that they have in there. Sometimes they'll list like 5 or 6 of them. And I'm like, I don't need this one, or that one, but I have them on file. So that's the first thing. So you need to have the referral in place before you have the visit. So I get the referral and then verify on the policy just to make sure that that code is listed there. And then, have the session and then Adam files the claim. If it isn't covered, there's like a little thing at the bottom when you get the paperwork back that says like what you charged, what was reimbursed, if anything, patient responsibility, if any. And then like if there's an error, there's like a little code and then like a line item that says something. Usually it's not helpful, but it's there. It tells you maybe what the denial was. You can use that information to call the insurance company, or depending if you're using a platform like Paraportal, you can do what's called a claim, or Navinet is one of the ones we use. And you could do a claim investigation. You could do the same with Paraportal too. And so you can investigate the claim. This shouldn't have been denied. This is a covered service. This is a covered code. Whatever your explanation. Sometimes they just need to reprocess it, and that has happened before. And sometimes it requires calling to figure out why it was denied. And it could be they don't have specific medical benefits for X, Y, and Z. Usually that's not the case if you've gone through the steps of getting the referral, checking the policy, and making sure that it is something that's covered.
Usually more diagnosis codes is better. Like if you have a code for hypertension or something related, that's actually, it adds legitimacy to your claim. Sometimes if you do perform a service that isn't covered, let's say you do just phone only and the insurance company doesn't cover that, they just won't pay you. And yeah, unfortunately, you end up just not being able to file that claim or not being able to get paid for it.
And in those cases, you likely can't also bill the patient, because that's something to keep in mind, is that if it was a service that was intended to be covered, the patient was intending to be covered, you were intending to be covered, you really can't bill the patient for it. And that can get a little sticky as to what's in your policies and what's ethical and things like that. But
I was just wondering, you had mentioned changing from sole proprietorship to LLC, and you had to change some of your benefits. I was wondering if you could elaborate more on that process and like the difference in the benefits between the two. And
I say change, but I really just had to like dissolve one business and start a new one. And also meant that with insurances, I needed to get new contracts. which was a little easier to do because I was already in network. It was just making sure that the correct EIN was listed and the LLC and the new NPI. Part of why I did that is we want to hire dietitians down the line. And so one of the things is just making sure it was in place to have the group. And then I'm listed as the individual provider, but then with hiring dietitians, then we would have individual other providers too. And down the line, having other providers under Pros Nutrition, not just dietitians. So that was part of it. More of the protection too. So separation of like the business from personal aspect of things. So that was like another big one, is just to be able to, one, have that company and not be so intertwined. Like I'm still obviously entwined with the business, but it's so intertwined of, sole proprietor, you're really not separate from your business entity. And so that was the other aspect of it, is making sure they were really separate things of the business and personal asset too.
Thank you both so much. This is wonderful and really, really informative, really helpful.
Thanks for having us.
Yeah, thanks for having us.